All right, guys, back here at Max Life again. We're going to go through phase 3 of the lumbar, basically stabilization or functional movement improvement piece on here. So we're going to start with what we call a cross crawl, which is seems like a simple movement here. So you're basically going to start from your hands and knees through here. And again, the goal is to have a flat back through here. Again, I'm not arched, I'm not sagged down, I'm just neutral position. Same thing, head's in a neutral position. And all I'm doing is I'm extending my arm as well as my leg on the opposite side at the same time here. So I'm going here, extending straight back, contracting, feel it through my glute, feel it through my shoulder, feel it through my torso. Back down, controlled, out here, back down, controlled. I should have the visual in my head. I have a glass of wine sitting on my back, and I don't want to spill it. In other words, it is stable through there. There's no movement that happens. When you start, you may have a decent amount of movement that happens through there. If you have to start by just doing one arm by itself and one leg by itself, that's fine. But get to the point where you're able to do this, and you can actually go through it at a faster rate because of that stability being there at that point in time. It's a simple way, again, to activate what we call a normal walking movement. Because when you walk, you flex and extend on the same side, the opposite sides through your body. That's why we do it that way. Way to make it a little bit more difficult is to add the ball in with it. Same thing, torso's being suspended basically on the ball. I'm going here, extend, opposite arm, opposite leg. One arm, opposite leg. Back, hold and pause, contract, back through there. So you see me from this angle. Notice how my arms and my legs are still within my torso at this point. And there's not much sway to my movement. Right through there. Again, spine's in line going through this stuff. So that's the first piece that's on there. Next thing we're going to do is a lunge. I'm not a big fan of this. It's hard on people's knees and most people are out of control when they do it. So honestly, like the starting point is just to get yourself in a lunge position and dip. I don't care if you go all the way to the floor or not. I just want you moving to activate that glute on that side, or in this case, to activate this side glute. I'm driving through that heel to get back up. Drive back down, drive through the heel to get back up. Both sides, again, I'll straight from the front here. I'm here, take my hips down, drive through the heel to back up. Torso's up, head's up. I'm not doing this to get down there. If you have to start by just doing just this, that's fine. Start with that level just to try to get a little bit more of that movement in terms of you moving forward with this progression through here. So there's that part of it. The other piece you can do with this is to take that step backwards. In other words, I'm going to start here. A lunge backwards is to go back, extend, touch, and back up. Same thing. Notice my torso stays up, back here, drop, back down. Make it easy. Back down, try back up. Next thing we're going to do is go through a side lunge at that point. We're going to start, the beginner level is doing just this, where my feet are apart, and I'm just going to sit right behind me. Arms out, counterbalances me, back up. Arms out, counterbalance me, back up. From this perspective, same thing. Notice where my center of gravity stays over my knee. Back up there. Down, back up. I like to think of that from a visual standpoint, that I'm sitting down behind that leg. So I'm here, sit down, back up. Same thing, sit down, back up. And you get to a point where you don't need the chair there, obviously. So that's a side lunge through there. Very simple with that. More complex, start from a normal stance, reach out with the foot and side lunge through there. So I like to exaggerate the step up, back out, sit down. Back through here, step up, back out, sit down. At that point, I'm working on mobility as well as strength. I'm driving through my heels more than anything on this. So that's that piece that's on there. Next, we're going to work on squats. Some people, we just want to start with getting out of a chair. So get a chair, sit in the chair. You're going to start with this movement here. Most people, when they get out of a chair, they do this. They do a couple things. One, They typically push with their hands. 2, they rock forward and use their momentum and push off through here. I want to get you comfortable with going from curve, curve, up. And you think of it as activate your glutes first, then push at that point. Versus if you're not activating your glutes first, it's this. It's always rocking forward because you have to get the momentum to use your quads. Squats and standing, and basically from seated to standing, should all be through your glutes. So activate your glutes. When you do it, you know you've done it because your head will come up. Watch my head. As it goes. So activate my glutes, drive, come up. So that's a simple thing to do. Drive, come up. It's all glutes, then into the quads at that point in time. So that's the first step. Just get used to doing that. Second piece now is a normal squat type movement without a chair at that point, because we want to work on some depth. So again, shoulder width apart, knees or feet slightly out, about 5 to 10 degrees out is all I'm doing. I like to use my arms out, keeps my torso up. I'm going here, dropping my butt, just like I'm sitting in that chair again, all the way down, rest, come back up. Same thing from the side here now. I'm here, arms out, screw my feet in the ground, knees come out, drop my butt. I'm comfortable. I can stay here for 10, 15 minutes here now. I'm back up, drive to those glutes at that point in time. So again, a squat seems like a simple movement. Most people can't do it because they don't have enough pelvic movement nor enough strength and stability through their glutes as well. So that's a squat. Next thing we're going to do is real simple through, again, your lumbar spine. Again, I like the exercise ball because of what it allows you to do. We're going to do some lateral movements through your torso. Now, honestly, you could probably start, you could use this is a weighted ball, for example, where you can work on that movement we talked about earlier, just to work on dragging the body over. I like incorporating this, because people sit a lot, therefore let's train you while you sit. Same thing, lateral movement through here is an easy thing to do. This ball's a little bit wide for this. Or you can start above the head, lateral movement. Lateral movement. From the side, again, you'll watch torso's upright, lateral movement through there. So pretty easy. Next thing we're going to do is rotation. Rotation always adds a little bit more complexity because it's a harder movement for people to do. With our lumbar spine, we're going to start with this. Ball's close to our chest. We're going to rotate. We're going to rotate. The thing I'm not doing is doing this. I'm not forcing this, so I'm rotating with my body over that side, rotate over that side. Now I'm going to make it harder through here. I'm going to do here, rotate over that direction. Rotate over that direction. This is 2.2 pounds. It feels like about 20 when it's extended out from your body like this. So through here, develops again the core strength as well as just more than anything the ability for those muscles to work together. The last piece we'll do is through here. Same thing, rotation. We're going to rotate that way, back that way. I'm using the ball to roll my body through. Very simple through there. So again, rotating back and forth. That's phase 3 of the lumbar spine stability.